In rural southwest Uganda, too many babies and young children die from preventable illness. Too many women still die from pregnancy-related complications. The Maternal Newborn and Child Health Institute, also known as MNCHI, is a new institution established in 2012 within Barra University of Science and Technology. Its goal is to strengthen programs, train and perform research to reduce unnecessary burden of disease and death in babies, children, and women. MNCHI builds on many years of community-based health educational programming and leverages the recognized expertise in the institute, which has developed at the university. Faculty and students have worked and provided service in conjunction with local communities and local health facilities for almost 3 decades. Over the past 10 years, maternal and newborn child health initiatives have been more formally developed, implemented, and evaluated within the Healthy Child Uganda project with assistance from other partners. MNCHI will sustain and further grow this momentum and expertise and produce a new generation of health leaders, strong programs, and solid evidence in this fully Ugandan-led initiative. Dr. Jerome Kabachenga envisioned the institute and has worked with the motivated team from Barra University for its establishment. Today, he is the director of the institute.
The institution has come as a result of our past 10-year experience in working with the various communities in the southwestern region, where we have been involved in projects aimed at community empowerment, especially in the area of health and social development. And we needed a structure within the university that can host these initiatives that have been started, that can get involved in the trainings or education of the health workers and health community volunteers or community health workers, and also to participate in research so that it answers some of the questions which we have, and also to help in supporting the health systems of the various districts we are working with. And at the same time, the institution is required to create an enabling environment for our training programs at Mbarara University, where students will find active programs in the communities where they can be attached for educational purposes.
The Institute's activities are of 3 main types: community programming and service, education and training, and research. In communities, MNCHI will continue to partner with districts, communities, and other partner organizations to develop and implement programs that build strength in health systems, facilities, and in communities. Healthy Child Uganda will continue as a flagship program.
For a program to be very successful, there must be community participation. There must be ownership at the community level. So the Mama Toto approach was actually like interlinking the 3 key levels for health service delivery: the district, the health centers, and the communities. So that triangle was very, very key, particularly the link with the communities, because people improved the utilization of health services and even awareness of the available services at our various facilities. But also it enabled the community structure, the village health team, to work with us better, to get to us, and even equip them with the necessary knowledge and skills.
MNCHI team members have developed expertise in training health professionals and community health workers. They have also supported community-based MNCH training for must health students such as doctors, nurses, and lab technicians in training.
When we send students to areas where HCU has been and now the institute, they find an organized system where the students easily fall in and learn how successful programs are done. And it helps us to motivate students, for example, to go back and work in the communities, because then they see where things are working. So the institute helps us a great deal to provide ideal teaching sites for our medical and nursing students.
MNCHI will continue to offer certificate training to community health workers.
This institute has come at a time when there is so much proven knowledge about how things will be done right. And many of our institutions have been developed in a way that has not changed in many years. And I see optimism in this institute because we are building it at a time when we have all this body of knowledge that is proven on really effective methodologies to deliver health education. And I'm very optimistic that as a young institute that is developing, we are going to have the opportunity to incorporate this right from its inception and grow with it to have maximum impact in maternal, newborn, and child health.
With over a dozen significant research projects now complete, MNCHI team members have contributed to build evidence for better understanding of community health worker programming, use of electronic technologies in health data management, and integrated case management of childhood illness at the community level. This process of research is not just to know what are the problems, but we also get to know what needs to be done, what interventions we should be implementing. But also, importantly, we move forward when we implement activities, when we provide, for example, intervene, for example, by providing small equipments at health facilities. Then at a later date, we also go ahead to find out if there have been changes, the kind of changes that we desired, the communities desired to have, in terms of improvements in for example, improvements in the health of the mothers, that they are now able, for example, to be delivered at the nearest health facility, that health workers have the tools they need, to provide services. So we do follow up research or evaluations to be able to understand if, we have made an impact in the community.
In a country which is still needy with so many problems at the primary health care level, it definitely sets a very good concept for learning in the primary health care setting. I know there have been challenges on implementing primary health care, but we need to build a new generation of people who can actually see and visualize. So having students, having an institute which can do both, use the service provision they are doing and also link it with academia is a very good opportunity for us, and we are very excited about it. We've already discussed about it here, and it's going to be one of the first of the kind in the country, that. So they're going to be pioneering also this area in the country, and we look forward to working, personally I look forward to working very closely with them.
All these moves are geared towards making a better future for children, and also making sure that the populations to come will be healthy and will be able to, if you don't have a healthy population, you cannot talk about economic development. You are wasting your time. Yes. Economic development, the backbone for economic development is a healthy population. The healthy population comes out of children.
The Maternal, Newborn and Child Health Institute He is dedicated to be a leader in Uganda and even in sub-Saharan Africa in research, development and delivery of healthcare services for mothers and children for many years to come.